Wellbeing Board. Councillor Simon Jones is no longer a member of this board, and so the first item on the agenda is election of co-chairs. I'll be asking for nominations for local authority co-chair and one NHS co-chair. Once appointed, the local authority co-chair will take the lead for this meeting. Firstly, is there a proposal for a local authority? Do we have a nomination for the local authority co-chair? Councillor Cecilia Motley. Thank you, Cecilia. Can we have a proposer, please, and a seconder?
I'm happy to propose.
Thank you, Rachel. Proposer.
And a second. Thank you.
Tanya, seconder. Thank you. Is there now a proposal for a co-chair from the NHS?
Can I propose Simon Whitehouse?
Simon Whitehouse. Thank you, Simon. Thank you, Cecilia, for that proposal. And can I have a seconder, please? Thank you, Claire. Can I just check that we have no other nominations for this? No, thank you. Thank you very much, everyone. As there be no other nominations, I'd like to now welcome Cecilia Motley and Simon Whitehouse.
You need to take a vote on it.
Oh, sorry. Thank you, Michelle. Can I just take a vote, please? First of all, for Councillor Cecilia Motley. Thank you, and for Simon Whitehouse, please. Thank you. We've got consensus for that, so I would like to officially welcome again. Simon Whitehouse and Cecilia Motley as co-chairs of the Shropshire Health and Wellbeing Board. And I will now hand the meeting over to Cecilia, who will be the chair for this meeting. Thank you.
I'm sorry about.
I think you need to be on silent.
Right.
Microphone. Change the microphone over. She's not right. That one answered.
This one was working rather dodgily yesterday. Right. I'm so sorry about that, everybody. It's a fine start, isn't it, to my time as chair to just start squeaking at you. So, good morning, everybody. Welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Cecilia Motley. I'm co-chair of the board now. I'd just like to say that I have recently taken over the role of portfolio holder for communities, health and adult social care. Previous to that, I was doing another role, and previous to that, another role. So, in other words, what I think I'm rather clumsily trying to say is that I've got a certain amount of experience in local government. I've been a local government councillor since 2009. So hopefully I will have a little bit of background to the work that's been going on. I was also a member of the Health and Wellbeing Board before being elected chair. So hopefully we'll get through without too much of a mess today. And any messes that I do make, I apologise in advance for. What would be nice, first of all, starting with members in attendance, if we could just go around the room so that I can be clear who everybody is and you can be clear too. Shall we start with you, Rachel?
Thank you very much. I'm Rachel Robertson, Executive Director for Health, Wellbeing and Prevention, Shropshire.
Good morning, I'm Lynn Corley, Chief Officer at Health at Shropshire.
Good morning, Tony Miles, Executive Director of People at Shropshire Council.
Good morning, Claire Parker, Director of Partnerships and Place at NHS Shropshire Telephone Weekend.
Morning, Stuart Bill, Superintendent, West Mercia Police.
Michelle Dulson, Committee Officer for Shropshire Council.
I'm Nicola Diamond. I'm the Director for Strategy and Integration for NHS STW.
Hi. Oh, has it gone on? Yes. Hi, I'm Jackie Jeffrey, Chief Officer of Citizens Advice Shropshire, and I represent the Voluntary Community Sector Assembly.
Hello, Penny Basin, Head of Trade Partnerships, Joint Role, Shropshire Telephone Weekend, NHS and Shropshire Council and Public Health, Officer in Attendance.
Morning all, Laura Tyler, Assistant Director for Joint Commissioning, again a joint role.
I'm Val. I'm Val Cross, Health and Wellbeing Strategic Manager in Public Health, and I'm in attendance rather than committee member.
Thank you all for that. We've got quite a lot of people on screen. We have quite a few people on screen. So can we start with you, Simon?
Morning, everybody. I put in the chat, really, apologies that I can't be there in person this morning. The weather and the roads got the better of me, but I'm Simon Whitehouse, Chief Exec of the Integrated Care Board across Shropshire, Telford and Wrexham, and delighted to be co-chairing the Health and Wellbeing Board now with Cecilia.
Paula?
Good morning, everyone. I'm Paula Mawson, Assistant Director for Healthy Population at Shropshire Council. Apologies for a meeting. I'm afraid I'm COVID positive today, so I thought it'd be best at home.
Stay there.
Yes, exactly. And there are a whole lot of others who I can hardly see.
We've got Laura Fisher.
Oh, good. Yeah.
Morning all. Laura Fisher, Head of Housing Resettlement and Independent Living at Shropshire Council.
And Ian Horton.
And Ian, yes. And who else?
Morning, everybody. My name's Ian Horton. I'm the Strategic Lead for Drug and Alcohol Treatment Services for Shropshire Council.
And that's Gerald that I can see above. Yeah. Great. Anybody else?
No, that's all. That's
good. Okay. Well, thank you very much indeed for that. We need now to get on to apologies, and we've had apologies from Ben Hollands, Patricia Davis, Sarah Ellis. Councillor Kirsty Hurst-Knight was actually going to be here. She may come in later. I don't know if you've heard anything from her.
She's on her way in.
Yes, I suspect she's having trouble sliding around the roads as well. And David Crosby. And if we can now get on to disclosable pecuniary interests, just to remind members to disclose any pecuniary interest in any matters to be discussed, which is not included in the register of interests, and leave the meeting prior to the matter being discussed. Any? No. Right, lovely. Thank you very much. Okay, so if we move on to item 4, minutes of the last meeting, we'd like to approve the minutes from the meeting held in November. Do we take a vote or do we?
I don't need to vote, do we, Michelle?
No,
no.
We don't normally, I seem to recall. Okay, everybody's happy with that.
Oh, we do. I'm sorry.
Oh, we do. Okay.
Yes.
Can I ask members if they're happy with the veracity of the minutes of the last meeting? Everybody happy? So if I can summarise the follow-up actions and notes of to highlight in these minutes, these include health partners. Consider who from their service could attend the Healthy Lives Steering Group. Contact and nominations have been received from 3 partners, and Val is grateful for that. Are you not?
And we've actually got 4 partners.
That's
another
right.
partner.
That's great. Also, air quality paper confirmed that a further update will be provided to a future meeting, and actually it's coming to this meeting, isn't it? The safeguarding annual report is being provided at this meeting, having been deferred. And leadership for different translation services across the system is a risk which we need to discuss. And the Healthy Lives report submitted to this meeting explains that a full report with recommendations will come to a future Health and Wellbeing Board. In the meantime, the board's asked to note that leadership for this work will be needed and thus remains an ongoing risk for the board to consider. So that's for us to take into account, I guess. Share information provided from the cost of living presentation back to partner organisations. So is everybody happy with that? And I move that the minutes of the Health and Wellbeing Board meetings held on the 17th of November 2022 as circulated with the agenda papers be signed as a correct record. Could I have a seconder, please? Thank you, Tanya. I'll now accept these minutes as a true record unless anyone indicates differently. So is everybody happy with them? Great. Okay. Thank you very much for that. I'll sign them afterwards. Yes. Right. We've received some questions from a member of the public which came in after the deadline for a response at this meeting. but a response will be provided outside the meeting and placed on the council website. Okay. And now if we move on to the ICS strategy update. Nicola, could you take this item, please?
Thank you, Chair. I think Rachel and I may do a little bit of a double act on this paper, as is our custom. Thank you for having me back to continue to bring an update on where we are with the development of the ICS document and our next steps. I think you have several attachments in the pack. I think you have the integrated care strategy pack itself and some information around our ongoing engagement processes. I'm pleased to say, as I think several people in this room are aware, we did take the draft integrated care strategy to the integrated care partnership board just in the run up to Christmas, and had a really good discussion, I think, and set of presentations around how the ICS document had come together. The ICP approved those documents that you have as attachments today at that meeting, and we're continuing, I guess, to socialise and discuss those with stakeholders and partners now. The ICS document is now part of the ongoing work for the ICB in starting to think now about our joint forward plan, which you'll hear referred to often as the JFP. This has previously been known, I think, as the 5-year plan, the forward view. We do seem to have settled now on a language of the joint forward plan, if you hear that. Rachel and I, if you like, can talk briefly to the slides, if that would help today. Would you like to?
Yes, very much so. Yes.
Val, are you able to just very briefly share that presentation? While Val is doing that, I can say that alongside this, we've started the design of what our engagement process for this is going to look like now, as well as starting to think about the joint forward plan. We'll just take a quick look at the contents page, because I think it gives a sense of what's included within the document and the breadth and scope of the document. I'm just trying to open it on my screen as well, so bear with me. If we can just move through a couple of slides now. Sorry, I'm having trouble opening it myself. There we go, I've got it. If we can move through to slide 5, thank you, that's the one. I think it's important to note that what's been quite central in developing this document has been really that thinking about how we will work differently in the future, and how we've shaped some of the content of the document in line with that. And as you will have seen, these are some of the key principles that we've adopted in doing that. Keeping a focus on people first, really strong focus on prevention and health inequalities across STW, and being very cognizant of the importance for subsidiarity, and really thinking about localness, communities, and how we take that as close to people as we can. The joint working and partnership being a very important key feature. Empowerment for our communities, opportunities to think through self-care and education opportunities around people's health, and of course that focus on evidence, innovation and research as we're moving forward. I'll flip through, if that's okay, to slide 8, Val, which really highlights these are the national objectives, I guess, that were set, the 4 key aims that were set for integrated care systems and those plans. and we've shaped our document in line with those. And they're very clear, as you can see, a role for improving outcomes, tackling health inequalities, whether that be in outcomes, experience and access to services, which of course picks up on a lot also of our rurality issues that we know is important, that broader social and economic development and enhancing productivity and value for money. And you will have noticed that the document is shaped quite considerably around those themes. Before I hand over to Rachel to just talk about some of the high-level priorities that came out from that, just talking quickly to this slide to put it into context of where we're going, what happens next. As you can see, the Integrated Care Partnership has now taken the oversight and sign-off for that Integrated Care Strategy, which in turn has been passed to us in the Integrated Care Board. We're now working through the development of that stakeholder management and engagement process to use that to start shaping now the joint forward plan. The joint forward plan needs to be submitted at the end of March. We've got a slightly longer time frame through to June to think about further engagement, dotting our I's and crossing our T's. And then we'll start to see some delegation of some of that activity into our operational work down at place, working closely with those place-based partnerships, and then feeding quite appropriately through from that back into health and wellbeing boards. And we start to see there a cycle of this workflow through our system. I'll just hand to Rachel to perhaps talk to the next couple of slides, because that focuses very much on the work both for Shropshire and Telford Health and Wellbeing Boards and some of the joint priorities that came out of that too.
Thank you. Thanks, Nicola. Can you just let's go next slide, please. That's what I'm trying to do.
Sorry,
I think whilst it's just moving on, I think it's really important to stress, first of all, this is interim. And we have received feedback from various boards and bodies that we've been to, including the ICP itself. And what we've done with that is there will be a further version of this, if you like, with a bit more detail around some of the points that were on here. For example, mental health, there was a aspect dementia within that. And so to be more explicit around that. So that piece of work is happening. Hopefully, I'm looking at Claire, by looking at the end of the month, Nicola, I think you've agreed that through. So there will be another version of this interim with those amendments in that have been brought in by parties and stakeholders. And actually, through the engagement work that's going on through the joint forward plan, we will be keeping a close eye on this and making sure that it's up to date and relevant. There was lots of questions around the vision as well, which have come through. And again, there's work going on around that. Again, to stress, this is really high level. This is the principles. These are what we kept calling the hooks. This is the where we want to get to, if you want, the detail of the how we're going to do that, because actually each and every one of these is very detailed, actually how we deliver and meet our priorities and how the enablers that will get us there and the way of working, there's an awful lot behind that. So this strategy is high level, it's what we have to keep coming back to and holding ourselves to, but the detail, the devil will be in the detail, and that's why the joint forward plan is so important. So as I said, this is very high level. What this slide does is summarise the next slides within the pack actually, and pulls together for Shropshire, Telford and Wrekin, because we've recognised within this the importance of place, the importance of the priorities we've identified as a health and wellbeing board. Some of those will be taken forward within the Shropshire area, but so this is where we saw the overlap, the priorities that we identified particularly for the system that we could work on collaboratively together. And I think the way of working, as Nicola said, is absolutely picked up in the slide previously. None of this is going to happen unless we get that way of working right, which I think that we demonstrated as a kind of board and the way that we work. So these, we've split the priorities that come out of the GSNA, come out of our health and wellbeing strategies, come out of clinical priorities that have been set, come out of the brilliant engagement work that's been done through Health Watch and organisations, and told us what the public, what our stakeholders believe is really important. And we've summarised these into 3 key areas that we want to focus on. So the population health priorities, and I'm sure colleagues will recognise those from around the room, and it's fantastic. We've got, for example, drug and alcohol on the agenda today. mental health we talk about over and over again, and that does include dementia, and we talked about healthy weight in our last meeting. So these are issues that are impacting our whole population across Shropshire, Telford and Wrekin. So just those are there captured in the public health population health priorities based on the JSNA and the data that we've as a board and partners have collated. As I said, the health inequalities, it's fantastic that health inequalities, we talk about it at every board meeting, the importance of inequalities and addressing inequalities. We had, at the last Health and Wellbeing Board, we signed off our health and inequalities plan, the first one that we've had within Shropshire. We've got a system-wide health inequalities plan, and at the cabinet meeting yesterday, it was endorsed by our Shropshire Council cabinet, which is fantastic, a really strong feeling that absolutely we need to be working towards tackling inequalities. We broadened that out because we recognise those wider determinants and the importance of tackling those wider determinants and improving health outcomes. And so you can see there just the priorities, and particularly important, you'll see within there what is called the core 20+5, and rural exclusion is our plus factor in our system, which is again really important, and raising the profile of that nationally as well, and the impact that has on health and monitoring that. So again, so you'll see those in that middle column, if you like, and then the health and care priorities. These are what we know is important to our public, to our system, to our clinicians, and these are some of the NHS priorities that have been set for us, and absolutely where we'll continue to be focused. And we're really grateful to see primary care in there again. That was raised, but also pharmacy and the role around pharmacy. So again, that will be more explicit moving forward. So I wasn't going to go into all the detail because it's in the slide pack, but hopefully you can see we have. I think there was a question around, have we got multiple priorities? No, this kind of summarises the priorities. What you'll see in the following slides is the way we start to talk about how we prioritise prevention, early intervention, how we have the enablers are really important around things like digital, using intelligence to help us understand whether we're meeting this and whether we're focusing in the right areas and whether we're targeting. And as I said, and then the devil will be in the detail in terms of how we deliver that. But this is our high level hooks for what we need to do in Shropshire, Telford and Wrekin to improve the health and wellbeing of our population and give them the opportunity to, as we would say in Shropshire Council, live the best life. So.
Great, thanks very much,
Rachel. To Nicola, do you want to add anything else?
I think that covers it beautifully, Rachel. I think the only ending point that's appropriate to mention to that, I think, is that the Joint Forward Plan is not a reset. It's not a new document to start again. I think it's important to acknowledge, as Rachel says, this document has given us those hooks as to, what the big story on the what. As we now move into the how and breaking down what that looks like over a 5-year period, the JFP will be responding to the story that we're seeing here in the ICS. I think it's just important to recognise that is not going to be, again, a blank piece of paper document.
Lovely. Before I ask for questions, I'd just like to comment that it's really nice to see these brought together, because that actually, for me, coming fairly new into this, really starts to make the whole thing make sense. Sorry to be a little bit basic, but I haven't worked on this for ages and ages and ages, as a lot of you have. But just for me, this just really encapsulates what it's about. So I think that's really, really helpful. Have we got any questions? Yes.
Thank you. Yeah, I think it's really a good document, and I think it's really pleasing to see that life course approach, so that focus not just on kind of one end, our ageing population, but actually the children and young people element. I just had a couple of comments around two things. One on the person-centred. So it's great that that's in a priority here, the person-centred kind of, well, person-centred, it says integration within communities. I think it might be useful for officers and sort of working with this document when we're developing programs for that to be explained a little bit more, just because I think person-centred, proactive prevention, population health, they have such, you could sort of build a Venn diagram around them, and it's everything in a way. It's kind of that one-to-one connection between a clinician and a patient or a service user and a client, and it's around that kind of how do we sort of improve that health literacy and how do we have those really good conversations with people. It really starts there, but then it also goes into how do we support our communities to be able to support people and for people to be able to support themselves. And it's you know, and that's so the prevention and that proactive approach, it just is, there's so much crossover there. And explanations around that, because I think people sort of look at that and maybe not 100% sure of what that means and what that is and how it works. And the other one was around integration. So one thing that we're noticing on the programs of work that are coming through SHIP, the children's work in particular and others, is that perhaps as a system, do we have a signed up understanding of what we mean by integration? And I think it would help us to have something that we really have all signed up to, that we agree to, that we can go back to when we're working on programs, we're developing things, we're trying to do much more together to make better use, not just to make better use of our resources, but actually be a much better service for the client. So how can we, if we start to stray from that, or it's hard sometimes for different organizations with different drivers to do that because they have so many demands. So it would be helpful to have that kind of approach signed up to as a system. So that was it. Thank you.
Thank you. I can respond to that second point, particularly Claire and I looking each other across the room thinking, how timely is that conversation? So you and Rachel, so we were talking about that just last evening. So as part of the engagement process moving forward, one of the things we've been aware of is the need to have people on the same page as to these types of discussions and explanations. And one of the areas we've focused on in the engagement plan is getting into some of those kind of killer questions or killer issues. What are those little kind of nuggets that provide for us the opportunities, but also some of the challenges where we need to be on the same page and talk those through and ensure that we all are talking the same language, have the same understanding and the same buy-in and commitment to them as principals. So we were working through just last evening a pack to draw out some of these conversations to take into some of that stakeholder management now, to have exactly the conversation around some of those points, and that will be one of a number. Hopefully that pack will be sort of concluded fairly quickly, and then as we start moving into those engagement events, the type of conversation that you've just alluded to, I think we'll be able to get into in a much more constructive way to flush some of those conversations out. Thank you.
Thank you very much, Nicola. Rachel,
yeah,
just
to add to that, I mean, I think it's, as you said, it's really timely. We're having this conversation yesterday, and we're constantly reminded how we all interpret things slightly differently. So for me, there's a couple of critical things in there. You've mentioned person-centred care, left shift. What struck me yesterday in the conversations, it means very, very different things to different people. Primary care felt that it was all that meant everything to primary care. For me, I'm thinking it's you're talking public health communities. I guess VCS colleagues probably thinking that's us without. Does it mean without result? You know, it means different things. And integration being another really strong example, and prevention actually. The number of times we mention prevention, and some people it means secondary prevention, primary prevention. What are we even talking about? You know, it means. So I think there's probably some key definitions here that we need to be clear of as a system. Perhaps it's something I'm going to suggest, but like around our joint working as we look at how we work together. Some of this, there maybe need to be some focused sessions and conversations about what we really, really mean, so we can absolutely nail it down. Because as we said, this is very high level, and some of this it is open to interpretation. So I think through the kind of engagement, if we want to go and engage with public and wider stakeholders, there may be some that are flushed out already that we need to absolutely be crystal on. Because if we're all talking at cross purposes, we end up in wasting a lot of time around that. And that might be something we could do collectively in some kind of workshop, and as our development to that joint way of working, how it's going to be different. So that's just my observation. Really good question, and perhaps suggestion about how we do that quite quickly.
Yeah, and I think if I can say as a final point, and you'll see in the engagement document that's in your pack, we talk about phases
and timing of some of our engagement work, and talking to Rachel's point, you know, we appreciate it's going to be key to have some of those discussions internally quite quickly first. What we don't want to be doing is entering into that public and community engagement where, as Rachel alludes to, we're all looking through different lenses from our constituent parts. So again, it's about making sure that we're all on the same page in that conversation before we take that wider. Thank you.
Thank you, Nicola. Yes, clarity is all, I think, in this. Lynn.
I think what I'm going to say sort of feeds into what everyone else has been saying. I'm just mindful as Chief Officer of Health Watch of the people who speak to us every day about their experiences of health and care services. And for me, I think there's the questions that they might ask are things like, when are they going to see a difference? But also, when we're talking about a shared understanding, it's also about a shared understanding of what success will look like. How will the public know that all this work has been done and it is making a difference? And for me, I think some of this, it is high level and it's very complicated. And I think at the moment, it would be hard for a lot of people to understand how they fit into some of this and how it relates to them. So when going out to the public, I think there's some work to be done about language and explanation in order for them to be full partners in this, because I think it is extremely complicated. So for me, it's just about raising that issue really from that public perspective. When are they going to see the output of this? And I know we talk about the 5-year forward plan, but at what point are people going to really see a difference? Because people are very worried about what's happening in the here and now. And when you're in crisis, it's hard to look into the future and see what is possible. And so people want to see change now. So I think it's about being clear when things might happen, when people are going to see a difference, so that they're as invested in it as the professionals working in this sphere.
Thank you, Lynn. Yes, Jackie.
This is a really picky point. I appreciate this is high level and everything, but it's only on the bullet point on about prevention and inequalities and the wider detriments of health, where you've got homes, jobs, and education. So just having lots of jobs doesn't it doesn't stop inequality, because there's an inequality in the workforce, and I think we need to be sure we talk more about low income, because of the demographics certainly in the Shropshire place is that lots of people have jobs, but it's low income, and actually it's about increasing and working with companies and with the sector to rise wages. But I just think actually it's great the cost of living's all through the, you know, in this as well, but the cost of living crisis will pass. Might be a bit of a wait, but that doesn't mean to say that suddenly health inequalities are okay, because the cost of living impacts greatest on those on low income. So I would say it's not just about jobs, it's low income more than anything. But that's a picky point.
Laura.
And again, you know, I think echo the comments. It's nice to see, you know, this all being pulled together. Just a couple of points from me, I think, and again, it goes back to the devil's in the detail in terms of where people see themselves within this. So I can absolutely see what you're saying there, Lynn, because I think the carers element is you know, I'd like to see that much more strongly focused within this. You know, a lot of the health and social care economy is really supported by our valuable carers across the county. And just the other point in terms of the health and care priorities, I think we're kind of missing around the market management and the support there, because they're an absolutely integral part of that wider, you know, system support and you know, supporting individuals. So I think, I just wonder whether we need to, and again, the devil might be in the detail, because this is high level, to appreciate that, but once you get into that, I would like to see that play, you know, a really vital part within that. Just my comments, thank you.
No, that's very helpful too. Excellent. Anybody else?
I think just to say, to absolutely take those away, it's really helpful to have that feedback. And I think the point you've made is we need to make sure that is fed into how we're going to do it, because we can't improve. Well, we know how the systems, you can look right through this and say, and that's, it's got to be really out there, particularly in terms of the forward plan, but maybe we need to be more explicit in the document as well, so we can take that away. I know we're scribbling away. Okay, thank you.
Simon, I'm so sorry I missed you.
Not at all, Chair. I put my hand up to speak. You didn't miss me in the slightest. So a couple of points in terms of this. Then I'm delighted to see where we've got to with this. Obviously, important Rachel's point, and that it's draft and it's work in progress and will continue to evolve. So the comments here really helpful in terms of that. Coming back to the comments made in terms of 5 years is a long time. We've got a twin track, haven't we? We've got to deliver against a twin track. We've got to do the improvements here and now as we continue to work in partnership in the system. I don't think there will be a big bang of suddenly somebody's flicked a switch and it suddenly feels better for everybody and we'll set a date on that. I think we've got to absolutely stay committed to that improvement work that we're doing in partnership with NHS, local authorities and other partners, as well as then say, actually, where's the end point? Where do we want to get for the residents of Shropshire, Telford and Wrickin? And what does a sustainable health and care system look like that's much more than just what services are offered, but we've got to do the service improvement piece at the same time. So I don't think anybody's saying we'll wait until we've got a 5-year plan and then we'll work through that. These have got to run in parallel, but we've got to make sure that improvement work is aligned to delivering that end vision and not just lots of individual pieces where people are interested in doing that. The second comment then links to the point about a house, a job, a home, a job, and employment. I mean, I think I can see where that's come from in terms of the Marmot principles and the importance of that, which I think absolutely should be central to this. But you're right, Marmot's principles also said it's a job that pays you for the ability to make your own choices about what you can do in your life so that you're enabled to make those choices. So I think that's a really fair comment. And that one of the principles of the ICS is how do we get into that socio and economic recovery post-COVID, not just there. What do we mean by healthcare delivery? So I think that's a really important point for us to pick up as well. Thank you, Chair.
Thank you very much. Any more? If not, thank you very much for that discussion. I think I felt that was certainly helpful as far as I'm concerned. We don't have recommendations as such, but we are asked to note the detail contained in this report. So is everybody happy to do that? I would say so, judging from what's going on around the room. Thank you all very much. Can we now move on to the SHIP update? Penny?
Thank you, Chair. This paper is at this stage mostly for assurance for the board to understand that the SHIP is one of the key delivery partners of the Health and Wellbeing Board on the work that's been going on over the last few months. And it's it's in the paper and it's a very short paper and just gives some key actions. But in light of the conversation we just had and the new strategy, partnership strategy, the priorities that we have for the Shropshire Integrated Place Partnership do match really well, I think, with the new strategy. But I think it's probably worth saying that it would be worth us kind of looking across and making sure that what we're delivering as part of that Integrated Place Partnership does match kind of where we're going as a system. So I think I'm giving myself an action to take with and have a look at that. But I think they do, on first they look good. But I think it's worth us doing that regular review. The SHIP receives regular reports around children and young people on prevention, mental health, community capacity, and the voluntary sector, local care, supporting primary care networks as our priority as well. Again, on integration and tackling health inequality. So those are the key things that we are working on as a board, but I'm happy to take any questions.
Thank you very much, Penny. Any questions for Penny? Yeah, Tanya.
Thank you, Chair. It's just to highlight the fantastic work in the Oswestry area in terms of the test and learn site. This is a integration test and learn site across Shropshire Council's Public Health, Early Help, Children's Social Care and Shropshire Community Health Trust. It'd be really good for this board to have a more formal report, I think, in terms of the outcomes so far on the test and learn site and our plans to roll that out across the Shropshire footprint. But certainly the SHIP board were really impressed with the work so far, that collaborative way of working, and already seeing really positive impacts from our children and families in the Oswestry area. So it'd be good for this board, I think, Chair, to receive a more formal report on that test and learn site, but also that firm commitment from the partnership about how we ensure it's rolled out across the whole of the Shropshire. Yeah, thank you.
Lovely, thanks very much for that, Tanya. Anybody else? Any comments? Rachel, so sorry.
Yeah, so I was just going to reply to that and say, well, firstly, to thank the work of the SHIP board, because I think it's absolutely critical to the, as Penny said, to the delivery of the plan, and they do look very aligned. And it's, I think, what I was reflecting was the left shift, which is very embedded in the SHIP. Again, it might be an opportunity to have that language and get that language right across the system. So, on the comment around the into the test and learn site, absolutely, I think it's a prime opportunity to bring it to the board. We are developing a plan for the rollout, so it'd be great to have the board's input to that. I'm looking at kind of partners around the table, and as Tanya said, we've got some key partners, but we see it as absolutely as a partnership. So I know the police have been involved in some of the conversations and how it's that preventative approach. So I think it'd be brilliant to bring to the board and think about how we can scale that up collectively, but also how we broaden that out. And this board is the prime opportunity to do that, I think. So welcome that, and I'm happy to take that action away.
Thanks very much. Penny.
Just to say, I don't normally attend the practitioner meeting in Oswestry, but I did yesterday, and there was a bit of a review around because we're looking at expanding it. Joe Robbins, who leads the project, was asking for views of the practitioners around their kind of the principles that we should be operating around, and the feedback was amazing, just around how beneficial they found it for themselves, for the practice, for the families that they're working with, and the children and young people they're working with, but also that they the time it is saving them because they are working together. So one of the key issues is that in this system is that every service is so pushed that we're not keeping up, and if and in this new way of working, and the practitioners are saying, with this way of working, it is releasing my time because I know that service is doing something with that family, and if I go and do it, well, it's duplication. So it's fun, and just that their kind of testimonials are amazing.
That's very good to hear. Stuart, do you want to comment at all?
No, there's nothing specific. Excuse me, I'm losing my voice. No, there's nothing specifically I can talk to at the moment. The preventative work is a space that the police are really keen to move into. It's just a tricky one to operate in, particularly in the current economic climate, but absolutely is the right thing to do.
Thank you very much. Any other questions, comments? If not, sorry, I'm just noting that the report's actually for information, and picking up the idea of a more formal report coming to a further meeting. Would everybody be happy to see that? Lovely. Okay, thank you very much. Now, can we get on to the Better Care Fund, the Joint Commissioning Board? Laura.
So, just
where's Penny? Sorry.
No, it is. I was taking it today. You don't have to hear from me again.
So sorry.
we take concern. Sorry, Penny. Yeah. So I'm just representing the report today for the update on the Better Care Fund, but specifically around the Adult Social Care Discharge Fund. So as many people will be aware, last year, late autumn into the winter time, an additional fund was announced with additional guidance, published in November with a deadline for submission for 16th of December. You'll see in Appendix A, Shropshire's submission to that. So I'm coming to the board today to ask that the Health and Wellbeing approves the Adult Discharge Fund planning template, which we had to submit, unfortunately, before this meeting due to the grant conditions. However, we still need to have the Health and Wellbeing Board approve it before the 30th of January. And we're also asking the board to note significant preference system and efforts across both health and social care to manage demand for services, and note that a further paper regarding risk around funding gaps for hospital discharge and social care placements will be brought to a future board meeting. So there will be some additional work around the Better Care Fund as we move forward. Just in terms of some context, the fund that was announced which primarily in order to reduce the time people spent in hospital to improve system flow and also improve individual outcomes. So it's coming in 2 tranches, one through December and the second by the end of January. It is only temporary funding, just a note, until the 31st of March. We were also requested to do fortnightly risk reports on activity. That's as part of the grant conditions, with the second return due tomorrow, in fact. We've been working really closely with the ICS on this, so we've done a collaborative response and joint approach in terms of what the best, I suppose, the best resources and the best money spent on this. It is quite flexible, as long as it's meeting obviously the need and making sure that we've got swift flow through the hospitals. Just in terms of the fortnightly returns, you can see there that within the report that we've got to send back the number of care packages purchased for care homes, domiciliary and intermediate care, the number of people discharged to their usual place of residence, which is actually an existing BCF metric anyway, which you'll be aware of. The absolute number of people not meeting criteria to reside. So essentially the idea is that is to reduce, this funding will support to reduce that. The number of bed days lost to delayed discharge by trust, and the portion percentage of bed base occupied by patients who do not meet the criteria to reside by the trust. So rather than, because of the flexibility, what they're saying is, that they didn't want to send put any additional target sets alongside this funding, particularly as it came in quite late. Which has been quite problematic, but I think certainly working across with Telford and Wrekin and the ICS, we've really worked well together to get this in place. And just really, due to significant pressure and continual pressure, it has been a really welcomed additional resource to support the system. And just highlighting some of the additional work in relation to responding to the increased demand, and obviously with the industrial actions that are currently, as we speak, ongoing. Some of the additional things that we put in place to support the system around that. So I won't go through those. You can see they're listed in the bullet points raised there. So unless there are any questions, the appendix is there, but just to really note that there's a huge amount of work that the system has been doing right across both health and social care. And also just to note, in addition to this discharge fund, I haven't noticed it on here because it's only recently been announced. So you'll hear within the press nationally that they've also announced an additional 200 million to support discharge. That funding has been primarily aimed at bedded provision, with wraparound support to ensure flow through the hospital as well. So we are working again with our ICS colleagues and in liaison with Telford and Wrekin again about how best we do that. So that will be daily reporting, so we've just received the template on that. So yeah, there's a lot of performance reporting back to the system with the additional funding at the moment. So we're obviously working with on how best to do that. But I have to say the discharges have been consistently high, and even due to the seasonal pressures that we'd expect over Christmas, we have seen an improvement in discharge. I don't know whether Simon, you wanted to add anything to the paper at all.
Thank you, Chair. I'd put my hand up as well. So, look, firstly, let me start by recognising that the system has been under significant pressure, and let me recognise and apologise to patients and residents that might not have received timely care in the way that they would have anticipated or wanted. I'm absolutely clear that staff have been working tirelessly and relentlessly in terms of delivering that, but at times we've not met the expectations of what the local population would have expected. So it's important that I recognise and acknowledge that. In saying that, Laura's touched on this, but equally as important that I articulate to the board and share my thanks to Tanya, Laura, Natalie and their teams, because they have worked absolutely side by side and relentlessly as part of the system, and that response has been really has genuinely made a difference. We can see that both in terms of the numbers, but I think we can also see it in relationship and ways of working as well, which I think there's a lot to take from as we go forwards. The bit that falls out of that for me would be we need to make sure we're doing it so when we're not in a crisis, which I think the relationship bit will enable us to take forward and take on in terms of that improvement piece. So I would like to minute formally my thanks to local authority colleagues in that space, as much as equally thank the NHS colleagues and staff that have been delivering the care as well out there and working hard. So Laura's touched on the various strands of money and the various performance reporting pieces that go with that. I won't touch on that any more than Laura has covered, and I won't make any further comment on that. I think the recognition of the challenges and the pressures going forward, we continue to lobby about that, and it's clear the direction of travel is one where the BCF will become ever more important in terms of the vehicle to drive that integration, both from what has been announced just before Christmas in terms of the local authority settlement and the money that's going through that route to continue with the hospital discharge challenge, as much as what's coming through the NHS route. Our key and our challenge and our commitment is making sure that we work in partnership to combine that resource for best impact for local residents, and I'm confident that we can get into that space. Thank you, Chair.
Thank you very much, Simon. Tanya, you wanted to come in?
Thank you, Chair, and Simon took the words out of my mouth because I've just written down here a thanks. So it's been an incredible few weeks and a lot of learning has gone on, but relationships have been really strong across the partnership. So as Simon has done so, but to extend my personal thanks to all health and social care workers in this system who have worked incredibly hard over the last few weeks, coming in off their annual leave days, working New Year's Eve, New Year weekend. I think I saw Simon Whitehouse more than my own children that weekend. But as always in the Shropshire system, people go above and beyond for the right thing for our residents. So a huge thank you. So a couple of points. We are reviewing our reablement model. That's the right thing to do. We have increased our capacity with thanks to the additional funding. We are absolutely discharging more patients and more patients home, which is the right thing. I think in the past we have unfortunately placed people in short-term beds, so that's really, really positive. And that we've undertaken to complete a review of the Better Care Fund in light of the pressures that we are seeing due to funding and the capacity that we need to create due to hospital discharges. Thank you, Chair.
Thank you very much for that, Tanya. Does anybody else want to comment on this report? If not, can I thank everybody for their contributions? We have recommendations here. I'll just quickly go through them. To approve the Adult Social Care Discharge Fund planning template, note the significant pressure on the system and effort across health and care to manage demand for services, and note that a further paper regarding risk around funding gaps for hospital discharge and social care placements will be brought to a future board. Thank you very much for that. That was very helpful debate. Now, Val, over to you for the Healthy Lives update.
Thank you, Chair. This paper really is just more of a paper for information, as well as making sure we give regular updates about the Healthy Lives steering group, which is the prevention group of the Health and Wellbeing Board. The meetings have been going really well. We had a meeting only on Wednesday. We've now got Paul Mawson, who I can just see on the screen there, who is our chair. And it was brilliant. We had 26 people at that meeting, all across, the voluntary community sector, the health and health partners and local authority partners. And we, what we do at these meetings is have key areas of the Health and Wellbeing Board priorities, and it's not, and I keep probably banging on about this, but we don't just sit around and talk about it like none of us do. We don't just sit around and talk about things. It's a real doing group, and those relationships and links that we make with each other to move things forward are just brilliant. So I'm not going to go through the whole paper. One thing I will just highlight is our library, Shropshire Library Partners, a lot of the work they do, which supports the literacy and early years work with children, and just highlighting that the summer reading challenge, Shropshire Libraries had the highest joint uptake in the West Midlands region and had the highest percentage of boys taking part. So I think that's as well as everything else is particularly worth a mention. So if anybody's got any questions, it's only a short summary report. Happy to take those. Thank you.
Any questions? Well, as Paula.
Thank you, thanks Rachel for spotting me. I just wanted to add a couple of points to those that Val has made, because obviously I took over chairing the Healthy Life Steering Group from this month from Bernie Lee, who's moved on, and I have to say I was really impressed at the first meeting, with the level of attendance and the level of commitment from partners to attend, and the value that they found in it. The very first item on the agenda was a presentation from Energize around physical activity, and they've kind of challenged us all, I think, to think about physical activity a little bit differently, and they certainly did for me, with their vision being around eliminating inactivity. And it's a really bold, strong vision, and I just wanted to share it with you as one of the things that I think we could all think about, both in context of the healthy weight strategy and the work that we're doing around those kind of lifestyle issues. So I just wanted to say that I think it's a really positive group. I think the work that they're doing is really powerful and important, and I hope that I'll be able to build on that with the group then moving forward this year. Thank you, Chair.
Thank you very much for that, Paula. If there are no further questions or comments, can we accept the recommendations provided, please? Thank you very much. Right, now we move on to the air quality update.
Toby's online.
Toby, you're online, aren't you?
Hi there. Yes, can everyone hear me?
Yes.
Yeah, fantastic. Hi. So I've been asked to, the paper that's been provided is just an update on the air quality work being undertaken by Shropshire Council at the moment. And the main overview of that paper, not to go into too much detail now, not to take it as read, but the main update is that the work we're doing at the moment is very much to continue to review the action plans that are in place for both air quality management areas, that we have in Shropshire, which is in Bridgenorth Pound Street and Shrewsbury Town Centre. So we've commissioned a external specialist consultancy to do that work, Bureau Veritas, and they've come back and reported their initial kind of baseline assessment of what's going on in each area, what emissions are there, what's causing those emissions, and are the boundaries of each air quality management area correct. I think the key thing to take away from that is that these areas are where there's residential properties in Shropshire which are receiving higher than the annual current objective levels for nitrogen dioxide. So the action plan is in place, that we're developing is to put in place a concrete plan of how we can reduce the pollutants at the emissions at these properties, which obviously has impacts on health. So initial findings have still to be finalised, but the modelling has shown that diesel vehicles, as you would expect with nitrogen dioxide, are causing a substantial contribution to the pollution in each area. And likewise, in Bridgenorth, there's noted that there's some evidence that the bus networks are making quite a high contribution to the overall emissions there. And likewise in Shrewsbury, the traffic data that's been collated and modelled shows that, like good vehicles, so kind of delivery vans, etc., that they may be causing a substantial contribution to the overall emissions in the air quality management area as well. So those are some of the insights that we're going to be taking away and reviewing across the air quality steering group, the officer-led steering group that we have in place. And we recently had a meeting of the steering group, which was very, very helpful. Bureau Veritas presented their results, and there was discussion of the measures that we might be able to put in place, existing measures across the council and across our partners, but also Bureau Veritas will now be going away and reviewing the evidence that they've collated and that from the officer group, and making their own recommendations of what measures we should be considering in our action plans. So that was an overview. Overall, the meeting was quite exciting. There seems to be a number of cross agendas which are could be aligned at the moment. So there's a number of works going on in Bridge North, on the high street there, which are currently being planned, which have a potential to improve air quality. And likewise in Shrewsbury, there's some plans coming forward with the Big Town Plan and other projects in the town centre, which could well solve a lot of these issues and lead to an overall betterment for the residents that are currently being affected. So it's exciting, but it's also challenging as we try to align the timescales of the work to match the data that's coming in, and to see the action plan that we develop has to be. Recent changes that came into place last year mean that we have to make sure that we have a firm plan. We can't just say that we're working to reduce levels overall. We have to be able to show that the measures that we develop are funded, there's aligned funding to do that, and that they're feasible and achievable, and they will reduce the emissions within a reasonable time frame. So that work is all ongoing, and that's what's presented in the paper. And likewise, the only recommendation that we carry is that we recommend to be carried is that we provide further updates to the Health and Wellbeing Board as we go through. So if there's any questions, so I've covered a lot quite quickly there, but if there's any questions, please do let me know.
Thank you very much for that, Toby. Does anybody have any questions? Yes, Penny.
Can I just ask if the work is connected to the social value and commissioning and procurement work within the local authority and partners as well? Just thinking about opportunities we have as quite big purchasers of services to kind of link all this work up.
I don't know that specifically to the social value that you just mentioned. I know that Amanda and Sue have been sitting in, and there was some interest in linking it to the project place plans that are in place in both Shrewsbury and Bridge North, and seeing if that work could be aligned. But I don't know the answer to your question specifically right now, sorry. But I know that both Sue and Amanda are there, and they are inputting into the group when they're able to. But maybe that's something we could explore further.
Thank you. I think Toby's been quite shy here. I'd like to say thank you as Health and Wellbeing Board member, but obviously local member for Bridge North. The amount of work that is going into, trying to rectify this problem, and really, bring the public realm award that we got to work on the high street, local connectivity study, and also the car park strategy review that we've started informally with local residents that live around Pound Street. But also the main route in and out to schools. It's a massive impact if we take away that area and try and reduce traffic. Where is that displacement traffic going? So I think the real positive message is that we're working with so many partners on this, and thank you, Toby. And again, welcome another update, because it's really helping me in my job down in Bristol. So thank you for your time.
Thank you.
Any announcements? Toby, that's very helpful, and we would very much like you to return to us as this develops, and keep us up to date. If you'd be happy to do that.
Certainly. Timescales, we're looking to hopefully in the next 6 months bring forward a plan, but that's obviously changing as the project progresses and different measures introduced. So we shall certainly return to the next meeting with a further update when we're able to.
That's great. Thank you very much, Denise.
Thank you.
Thank you. Right, now we move on to the Shropshire Safeguarding Community Partnership. And that's Tanya.
Thank you very much, Chair. So this in front of the members today is the Shropshire Safeguarding Community Partnership Annual Report 2020-21. So this report fulfils the statutory duty of the Adult and Children's Partnerships to produce an annual report. I do note that this is very overdue, and I'd like to apologise on behalf of the Shropshire Safeguarding Partnership. We are currently working on 21-22 and hope to have that in front of Health and Wellbeing Board no later than May this year. So the report describes the information of Shropshire's new safeguarding arrangements as was. which was that single governance of the adults and children safeguarding boards and the community safeguarding partnerships. We are one of only 3 local authorities in the country that have taken that approach in terms of that combination of partnerships. In the report describes the achievements of the Shropshire Safeguarding Community Partnerships 2021 and the response of the partnership during the first year of COVID. You'll also note in that report the in terms of statutory review taken that year and describing the lessons that were learned during 2021. And the report also identifies the priorities for 21-22. So I know this is a bit tricky because we are going back a couple of years. So it's once again to apologise to this board for the delay in the report coming, but this is to note the content of the report and any questions. There we go.
Thank you very much, Tanya. And we also have Sarah Hollinshead Land online.
Morning, everybody.
Morning. Any questions? Any comments?
Thank you. Thank you. It was just a really comment. Thank you for bringing the report forward. I'm a member of the partnership as well, but this new structure that we've got in place, I think it's been a really interesting way of working, bringing all partners together, particularly around some of our key agendas. And I know we've got, for example, drugs and alcohol on the agenda today, but I think that way of working and the way of working through COVID, which the report highlights, there was some real challenges for us. And again, that collective response around some really challenging, there's some operational issues as well as some strategic issues we were able to deal with very collectively through whilst we were working through a new model as well at the same time. It's just a recognition of that and you know, and amend the report. So thank you.
Great, thank you all very much indeed. I'm sorry, Sarah, to have brought you on and not given an opportunity to speak unless there's anything you want to add.
Yeah, it just might be worth bringing the Health and Wellbeing Board up to date with now, really, just so people understand where we're at. We're just about to end the 3rd year of our strategic priorities in the partnership, and on February the 3rd we are about to hold a strategic planning and priority setting day, which brings all the partners together. That day will help the partners reflect on what's been achieved over the last 3 financial years, even though you're looking at the report from the first financial year of the arrangements. And it will also provide an opportunity to look at the structure and the priorities going forward and agree kind of how long those priorities should be for. I'm sure what you'll recognise in the report is the priorities that the partnership are trying to address and not issues that can be turned round in a short period of time. They're not things that they're societal issues that just can't be changed, and not even in 3 years. So the partners will need to give some thought to how long they want to run those priorities for. But I suspect we'll be moving to a period of annual review of those as we go forward. And that's probably it from me.
Thank you. That's excellent. We've got some recommendations with this. So we, no, we don't. No, sorry, we don't. Sorry, I've jumped ahead. No, this is just to accept the report. Thank you both very much.
Thank you.
Okay, now we move on. Item 9 to the drug and alcohol strategy. And we have Paula Mawson and also Ian Hawkins.
Thank you, Chair.
Yeah, haven't we? That's great. Yes.
Thank you. So Ian and I will do a bit of a double act for this item on the agenda. I guess just a few points from me at the start around the substance misuse programme, and I take us right back to the very first presentation, I think, from Nicola around the ICS and the system and our strategy and our priorities. And I think it's really important to see that focus on drug and alcohol right there at the heart of the system priorities and reducing the impact, because it will take that system level of working to fully, meet the scale of need and the scale of challenge around the substance misuse agenda. In this report, which I think it's been quite some time since the Health and Wellbeing Board had an update on the strategic substance misuse programme, so we've tried to give some highlights of the programme overall. And then if there are particular areas where the board would like further information or to have a closer look, then we can, provide additional reports moving forward as needed. At a strategic level, you'll see in the report the government has published a national drug strategy called From Harm to Hope. We've given you a sense of the priorities of that strategy. So there are 3 of them: breaking drug supply chains, delivering that world-class treatment and recovery system, which is obviously principally a priority for the public health teams as we are responsible for commissioning those services, and then achieving that shift in the demand for recreational drugs. I think locally, if we think about where are we at in terms of those priorities, we know there's been a lot of work done by our colleagues in the police already around county lines and reducing that access to drugs within Shropshire. From a public health point of view, certainly during 22, and I think for a lot of 23, our focus will be on that world-class treatment system and what does that mean for us here in Shropshire, and what more can we do with some of the additional funding that we're getting nationally to boost the services for our local residents. I think as we move through this year, Ian and I really want to then start thinking about what does achieving a shift in the demand for drugs mean, and how can we really build that preventative offer and enhance the work that's already happening in Shropshire to reduce people's use of drugs, their use of alcohol, and that will be a focus, I think, as we shift through into this year. You will see in the report as well that there is a combating drugs partnership across Shropshire, Telford and Wrekin in line with the national guidance that came out to support the national strategy. I've given you some headlines around the outcomes framework that will be used to drive improvements in delivery at the national level. You'll see there is quite a strong focus in the national documents around drugs. Alcohol is mentioned and we are expected to look at that, but I think one of the things we're really keen about for Shropshire is alcohol is our biggest area of need, and we need to make sure both through the Combating Drugs Partnership and our local partnerships that focus on alcohol use is really, really strong. Nationally, there are some set targets that we have to achieve through the Combating Drugs Partnership work, and those that are listed there for you. A couple to point out are the conducting that joint needs assessment, agreeing a local drug strategy delivery plan, and those are the things that are being worked on. And then we have to start reporting nationally on performance from April of next year. Our Combating Drugs Partnership is led by the Police Crime Commissioner, John Campion, across the Shropshire, Telford and Wrekin footprint. We are also locally doing a much more detailed needs assessment for Shropshire, and a further update on that work will come to the Health and Wellbeing Board as part of the regular JSNA updates. As you may have seen through the Safeguarding Partnership update, there is a priority group around the Safeguarding Partnership that focuses on drug and alcohol. I'm the Vice Chair of that group, and I've just given a flavour of some of the things that we're working on currently through that group. One is around re-establishing the drug and alcohol death review panels, which is a really key focus of work for us on the back of the pandemic, particularly in concerns locally and nationally around the death rates. That development of a drug and alcohol policy toolkit for schools, that work is well on its way now, and we're at the kind of final stages of reviewing the toolkit within public health before we can release that to schools. And then we've done a joint multi-agency case file audit with the neglect priority group of the Safeguarding Partnership, and there was some really strong learning that came out of that around how we safeguard our children and young people, particularly when they've got parents who may be using drugs or alcohol. I'll hand over to Ian then just for a few updates around the local services delivery before we open for any questions and comments. Ian.
Hi everyone. Just to say, I think we are alongside the national strategy, which was published last December, we had a local strategy which was published about the same time actually, and I think what we're in the process of doing is, as Paul has said, with the needs assessment, is just updating that in terms of having our local strategy. But in terms of moving forward, so that will involve some, I suppose, modernisation, maybe some tweaks to the service model and we've been done a great piece of work this year, which was to bid for some money that was available for rough sleepers, or for rough sleepers and those that are at risk of rough sleeping that have a drug and alcohol issue. So the government issued an invitation to bid for funds that they had available for that, and we managed to secure 1.4 million to cover us for at the time for 21 months. And what we've done as part of that is to set up a kind of a multi-agency team coming together. So we've got drug and alcohol treatment providers there. We've got local charities that do kind of psychosocial interventions and kind of non-medical support. And we've got a social worker within the team. We're going to have some GP time within that, a mental health specialist. So bringing them all together and working with those around with a caseload of around probably about 150 to 200 people, with the intention of doing some really intense kind of one-to-one work with those and some outreach work. So being able to kind of go out and find the pockets where those individuals are, and that we can tackle some of because particularly Shrewsbury Town Centre, there's been quite a lot of issues around people using substances within the town centre. So we're hoping to tackle some of that stuff, and hopefully this project will give us an idea really in terms of a new model around how we might structure our services to make it a more open access and to make it more integrated. So it's the crucial bit really is about pulling all those partners together. And we've got I forgot to mention there's a housing worker within that team as well, linked to Laura's team. So it's a real integrated process. Thanks.
Thank you, Ian. Thank you, Paula, very much. Does anybody have any questions, comments? Kirsty.
Thank you, Paula. I'm the portfolio holder for children in education. I just wondered when the toolkit is ready, am I able to see that? I'd just be really interested to see the work we've done, what's going to go out to schools.
Yeah, absolutely. We'll be very happy to kind of share that with you. We're sort of, as I say, going through kind of quality assurance processes with it at the moment, but as soon as it's ready to share, I'll send it to you, Kirsty.
Thank you.
Right, thanks very much, Kirsty. We've got Stuart next.
Thank you, Chair. Just a couple of observations, really. The work going on around county lines from a policing and partnership perspective, massively important. We made some huge inroads in May 2021. As a county, we had 24 active county lines coming in. Currently, at the most recent report, sat at 8. There's 8 too many, but there's real progress there, and that's a collective response to that. And then just on the outreach work for the homeless, really welcome that. Often we get reports of crime and ASB, but what sits beneath that is the vulnerability, the addiction and the treatment that's needed. And it's so welcoming to hear that we've got that approach to try and deal with it.
Yeah, that's absolutely right. Thank you so much for that, Stuart. Laura?
Yeah, just echoing really what Stuart's just said. So really welcome the Reset project, really excited about it. Excited to have such a multi-agency team working around rough sleepers, and just if it's not too cheeky to suggest, I wonder whether or not we could bring a report back at a later date to the Health and Wellbeing Board. I think it would be a really positive report that we could then update people on.
Yeah, I think that would be really welcomed from my perspective, Laura. We did have a kind of soft launch of the new provision last Monday, so the first Monday of the year. We had really excellent attendance from not just those partners that are formally delivering the Reset multidisciplinary team, but the wider range of partners that need to be aware of it and signposting into it and building those links. So, for example, there was really good representation from police colleagues at that launch so that we could start to build those links. We had street pastors there. There were discussions about the town rangers and how we can, link in with those as well. So I think we'd be really happy to bring not just a report, but hopefully some really positive outcomes for residents in terms of the difference that we're making. The final point that I'd like to make, if I may, is kind of looking ahead to this year. There's absolutely something for me in the prevention space. I think the other area that Ian and I are having quite a few conversations about is the links between people who've got co-occurring substance misuse issues and mental health issues, and that's an area where I think we can do more in Shropshire to support people. Ian and I have started to have some positive conversations with MPFT as our mental health provider about trying to unpick what does that mean, what could that look like, and what could a new model or new ways of working in that integrated space be. And so I think I'd quite welcome to come back to the board on that point as well, because I think that might help help us all to shift that space forward as well.
Many thanks for that, Paula. Tanya.
Thank you, Chair. So absolutely excited about the reset projects and look forward to a future report. And I guess my comment is around the prevention stage before somebody becomes a rough sleeper. So Stu and I have sadly sat through some children and adult safeguarding reviews this year, and a common theme in those reviews is substance misuse and the impact on children, adults and families. So I'm really keen to listen and hear what our thoughts will be in terms of a new model, a review of our approach about how we support both adults and children who are taking substance misuse, leading very chaotic lives. And I know professionals struggle at times to engage with those individuals. And what Stu and I have seen is not at times an MDT approach. And at times where if someone doesn't attend an appointment for two occasions, they are therefore taken off the list. And what comes through in these safeguarding reviews is a real frustration in terms of what can we do differently to work with individuals who have got chaotic lifestyles and do struggle to go to multiple appointments, particularly if they live in South Shropshire or in the real northern parts of North Shropshire, to be expected to go to a Shrewsbury location. So that would be my ask, really. Whilst I'm very excited about the money in the project, for me there is a step before someone becomes a rough sleeper, because we want to stop that, don't we? We want to be the prevention arm and support people on their recovery journey in a very different ways.
Yeah, completely agree with your points, Tanya. I think there's a couple of things I would say. We're quite lucky that the reset team can work with people who are at risk of rough sleeping as well, and that will be probably the bigger pool of individuals. So we need to make sure that everyone's clear on that point as well. I think for me, there's something about how we use the reset team and approach as a catalyst for broader change around how we support people with substance misuse issues, and that integration agenda, in the same way that we're working across in Oswestry for children, young people and families. We need to take that approach more broadly across the whole of the system of support for people with substance misuse issues. So it's something I think Ian and I are really committed and passionate about, and hopefully as reset kind of launches and we can step back from that a bit, then we can broaden out our focus onto those earlier interventions and the more preventative agenda as well.
Thank you for that, Paula. Rachel.
Yeah, I mean some of the points have been covered, I think, in the conversation. So I think well, as a general point, as I said, the reset programme, it was a fantastic launch. As I said, a very soft launch, but the opportunity, the comments that were coming back and how we make those links. So I think, as you've just said, Paula, things like the at risk and the prevention, we talked about quite a lot there. How do we get people when they're at risk and that prevention early on? And it's making the links into the various groups and organisations, because it's our own teams, it's our collective organisations around here, but there's a lot of third sector, we talked to the town parish council and others, where people have been identified, and it's getting those earlier and having that multidisciplinary integrated approach. So then that brings me, you've said it, integration in action. This is that comment back that Penny made around what is integration. This shows one of the ways that we're doing that and rippling that out. It's not just one or two organisations. I think Simon, at a previous meeting, you talked about integrating sort of NHS teams, integrating partners, integrating community. This is an example of that happening. So just to bring in that, I think the mental health bit, we've talked about that at the CDP, the Community Drugs Partnership. I think if you look back at our strategy at the start of the meeting, we talked about drug and alcohol being important. We talked about mental health, but that core where you've got you don't put people into boxes. That's not how it works. And communities and personalised care, all of that. So there is something we need to do better, I think, around that. And I know it's a priority in Telford as well. So those conversations are welcome. But again, that's a part of how we enact it. And I think I just want to finish with a massive thank you for the team, because the extra resource. This is a really important issue. It's important across the Safeguarding Partnership for the reasons we've just talked about, and it's across the Health and Wellbeing Board as well for those kind of wider in that wider context. It's a partnership response. I know we haven't had an update for some time, and there's progress being made, and there's a significant ambition. But a massive thank you to the team, because we've brought significant money into Shropshire to really give us a leg up to making some of this happen. And so just a huge thank you, because I know it wasn't easy. There's a massive amount of work gone into that, and it just gives us that chance and that platform to really move some of this forward that we were also passionate about as one of our key priorities. So thank you.
Okay, thank you very much. And finally, Val.
Yeah, I'll be brief because there's obviously a lot of interest in this. I just really want to sort of allude to what Tanya was saying about missed appointments, and just in general, really, this is why we know that the trauma-informed approach is one of the Health and Wellbeing Board priorities, and that just again emphasises how important that is in terms of having a system-wide approach to this. And we know that we are with you, for example, have that approach, and I know West Mercia Police, there's work going on with Ed. But if we're going to get a consistent response to people, this is an integral part of that as well. I just wanted to that comment really. Thank you.
Thank you all. That's been a good conversation, I think. Some really useful points coming out of that. Thank you very much, Paula and Ian. We've got some recommendations for this. So may I ask the board to note the launch of a 10-year national drug strategy from harm to hope in the establishment of a combating drugs partnership for Shropshire, Telford and Wrekin, receive an update on the Shropshire substance misuse strategy and needs assessment for substance misuse in Shropshire, note the update regarding substance misuse services delivered through the Shropshire Recovery Partnership, and launch of Reset, an externally grant-funded multidisciplinary team to support people who are rough sleeping or at risk of rough sleeping with substance misuse issues, provide support, suggestions and challenge to programme plans as presented to the board. And I think just to add on to that is to report back to the Health and Wellbeing Board on your progress, because this is an issue which is obviously often crosses over with many of the much of the work that we're all trying to do. So it's really useful to keep sighted on this. So thank you very much. So thank you all for that. Next, Health Watch, Lynn.
Thanks. Sorry, I haven't got a report for you today. I'll explain a little bit about that in a minute. So I just wanted to update you on a few things. The first is that we've had some really positive news at Health Watch Shropshire. Just before Christmas, we were told that we were successful in maintaining our contract. So we've got a contract for the next 3 years, which is really, really great news for us. I think it's fair to say as well, and I'm not sure that everyone on the board is aware of this, but we are a very small charity of just 4 whole-time equivalent staff. And the current economic situation means that we are going to, like so many other charities and small organisations, going to struggle over those 3 years to do what, as a statutory organisation, we were set up to do. So we are going to have to look at income generation in that time and look to our partners to support us to do our work, to hear and bring the voices of the public to these discussions. And really look at our capacity. We're not a fundraising organisation. We don't go out to raise money. So we will really need to look at how we can generate more income over the next period of this contract. 2023 marks the 10-year anniversary of Health Watch being set up nationally. So that hopefully there'll be some celebration where we get to highlight the work that we've been doing over the last 10 years. And so just bear in mind, you will be invited to be part of those discussions. And I suppose that will feed into what we do every year, which is an annual event. So last year we did a very successful event around end of life, where we were able to bring together all the work we've done around people's experiences of end of life, and also work with the ICB as well as CCG to promote the end of life strategy that had been developed. So if you have any thoughts or ideas about how we might be able to use our annual event this year in Q1 of the financial year, then please speak to us about that. So in terms of the work that we've been doing, obviously tendering for a contract takes a lot of time, but we have been continuing to do work, and I'll be bringing a report about the accessible information standard to this meeting. So this is something I'm personally very passionate about as an ex-teacher and an ex-social worker, in terms of people's right to access clear and understandable information. And that came out in 2017. We did a piece of work at that time. And I think it's quite concerning when we've gone out to speak to people who use services that there's still a large part of our population who do not know their rights under the accessible information standard. And I suppose the emphasis is that as organisations, it's everyone's duty to tell people what their rights are. It's not the onus on the individual to be able to ask for their rights to be met. So I will be bringing that report here because I think there's some quite easy wins that could be happening across the system for people to help them be empowered to take control over their use of services by giving them the appropriate information. The other thing that we've been doing, as you're probably all aware of, is asking people's experiences of calling for an ambulance in an emergency. And now as Health Watch, I know that this is a very complicated issue, and this is the report I hope to bring to this meeting today. But at the moment, I'm still waiting for providers and commissioners across the system to share with me the work that they've been doing to try to address this issue. Before I publish that report, because I think it's a really good opportunity for the public to see the steps that are being taken, because I know there is a lot of work happening to try to address these challenges. It's not an easy win. We know from the media it's a national issue, it's not unique to Shropshire. So I'll be much happier when I can publish that report with those responses in it. So we heard from 168 people, 160 of them from Shropshire, and 8 from Telford and Wrekin about their experience. And some of those experiences were positive. And, you know, people reported some good experiences, and particularly around staff. And I think that's something that we need to be able to celebrate. But we also heard some very negative experiences where people were concerned that about the impact of waiting. Not just for ambulances, but within the hospital, and then for discharge at the end of their experience. So I'm hoping that I'll be able to bring that full report and the actions that are being taken to the next meeting. At the moment, we're just launching our next piece of work, which is part of a Health Watch England national campaign called Because We All Care. And that is to try and encourage more people to share their experiences of health and social care with us, and seeing that as a positive and as an opportunity to highlight what's working, what could be improved, and how things could be working better for people, so that we get as much feedback as possible that then we can feed back into the system. And at the same time, we're also going to be looking at our forward plan for 23-24. And so what we would normally do, and what we've been doing for the last couple of years certainly, is aligning our forward plan with the priorities of the system, which we will continue to do. But as you know, just from looking at the strategy earlier, that's huge. So we really need to do some targeted work where we can ask people to share their views and thoughts and ideas and experiences with us, where it can actually make a difference. So if people have any thoughts about some focused work that we could do within that year, please speak to me, and we will put that into the mix and take it to my board for us to agree what we're going to be focusing on for the next year. So those are the main points I wanted to raise. So if anyone's got any questions, that's great.
Thank you very much, Lynn. Any questions, comments on what Lynn has to say?
That's also
Yeah, but Lynn, presumably you would like people to email you with any ideas for your annual event.
Yeah.
Yeah. Okay. All right. Thank you.
Yeah.
Great. Okay. The next one.
I think Jackie had a.
Oh, sorry, Jackie didn't say.
So I think as a BCSA rep on the Health and Wellbeing Board, I have to share your pain, as like with anybody across the system, about when you have a statutory function, how you actually be paid to deliver that statutory function, and being very focused on that. And the fact is, when you fundraise, everything comes with an outcome and a direction that that funder wants that doesn't necessarily feed into going and researching the impact of health and wellbeing. And yeah, I just wanted to share your pain with you. But well done.
Thank you.
Thank you both for that. Right, Rachel, next. We have this paper is for information. This is the health protection update paper. Does anybody have any questions or comments on it? Do you want to?
No, I mean, I think we brought this for information because we brought a more detailed update to the last report, so it is here for information. I guess I just wanted to probably highlight the some of the good news around the screening programmes for where we're seeing a recovery from the pandemic. Some of the screening programmes and work can continue. I think just recognising the difficult winter that we've had, the news on flu is that the rates seem to be coming down, and we're hopeful that they will stay down because we had quite a large blip in terms of scarlet fever, COVID, which obviously had quite a surge before Christmas, which impacted on our health and care services. Whilst those rates have come down, just to flag that doesn't mean we won't have a second wave, because I think particularly with things like scarlet fever usually comes later in the year, and COVID wasn't as high as we perhaps expected it to be. And again, so some positive news, but just a note of caution, I guess, within this, and we'll continue to bring these reports through for information to keep both cited. And I think the other bit is the good news around the health protection strategy that we now have across Shropshire Health and Region, again showing how we're working together around those kind of key health protection areas and the approach that we're taking to delivering that across the whole patch. It's quite a complicated system in terms of delivery of health protection with regionally, NHS, cross public health. There's a number of organisations as it would be involved. So the strategy tries to clarify that and the targets and the way that we're working, building on the learning from COVID.
Thanks very much, Rachel. Does anybody have any questions or comments for Rachel on this? If not, we can accept the recommendations, yes. Lovely. Thank you very much. And now on to number 12. This is another paper for information. Vaping and young people. Update.
We also have Victoria Stanford.
Good, Victoria Stanford. Do you want to
answer questions?
Yeah. Do you want to bring us up to date with anything, or answer any questions? Has anybody got any questions on this?
I haven't got a question, just morning, Victoria, it's Kirsty. Hiya. Just that you did say there's a recommendation that right, just a reference, if the Health and Wellbeing Board want to further update in progress with the work programme that could be provided. I just think that's really important that we keep receiving these updates, because it is such an important piece of work. But if we could just make sure that's an action, please. Thank you, Chair.
Yep. Thank you very much, Kirsty. Tanya.
Thank you, Chairman. Thanks for the updated report. As you know, at last Health and Wellbeing Board, it was me that raised the challenge over us suggesting that vaping was a safer way of someone not smoking. Whilst I absolutely get what the national guidance is saying, I still remain concerned about what this message is given out to our children in Shropshire, because our schools, without a doubt, are saying to me that children are vapouring more and more in the school. Vapouring has become the bigger problem rather than smoking now in school. And there is a causal link to exploitation, without a doubt. So within this report, I'm not seeing that loud and clear, and so that I want to put on record that I remain concerned about the vapouring that goes on. I do know that Trading Stand did a fantastic piece of work before Christmas and focused on some key establishments where under the counter behaviour was going on, which then does lead to other concerns from our children and young people in Shropshire. But I guess it's about how we educate, how we supporting our children and young people around smoking and vaping is not good for you, both for your physical and mental health, but also financially, and what that possibly could lead to. And I think, again, the causal link there is around kind of drugs, what happens after vaping. And I don't see that strong enough in this report today.
Victoria, would you like to come back on that?
Thank you. Yes, thank you very much for your comment, and thank you for having a look at the paper and reading through. And just to note, thank you for bringing up your concern. It is noted, and thank you for that. And we will certainly be considering everything that you've mentioned, how we actually manage to manage this risk in children and work with this really important risk that there is potentially, there is this exploitation link that has been noted, and that does form part of our task and finish group to look into that and make sure that we have a spotlight on that whilst we look at both the data and the communications around this. So thank you for your concern, and it is noted.
Thanks, Victoria. Any more?
Paula.
Paula.
Thank you, Chair. Tanya, I completely agree with the points that you're making, and with the level of need around this, and the assurance that we need to be giving to frontline professionals about what are the messages and the key messages that should be delivered. Some of you will be aware that Bernie Lee was leading this piece of work as our consultant in public health, and she has now kind of moved on to a new role. But I have agreed with one of our other consultants in public health to take a leadership role around this piece of work, particularly, I think, reflective of the level of concern that there is amongst a whole range of partners around the numbers of young people that are vaping and the mixed messages that seem to be out there. I do think it's really important that we make those robust assessments of the evidence base around the messaging, and that we're consistent with that. And it's difficult at this point in time because some of the evidence is quite clear, some of it's so there are still those kind of unknown risks around vaping. But I think where children and young people are concerned, the message is quite clear that vaping is not for them. It's only to be used as that quick aid for adults to enable them to stop smoking. But I hope with additional kind of leadership from one of our consultants, we'll be able to move this forward, and happy to bring further updates back to the board. Thank you.
Thank you. And I think it was just drawing the attention to the last point Paul has made. I think the overall message is vaping isn't for children. And it's how we, whilst we're working on the communications around that, I think Tiny's point is very key, that we need to be, it's not just communicating that, because that's and putting that message out to the media. It's actually proactively going out and working with our schools, working with young people, working with all of our organisations to keep that message going. And as Paula said, put an extra resource into that, because I think we have lost some of that preventative work that we need to see, and that it's become confused. And as you said, there's excellent work going on, but that's the takeaway message if the media are listening online. And I know that was picked up in some of the Shropshire Star the other day, but that's the key message that we need to get across for our young people.
Oh, I quite agree. Thank you very much, Paul and Victoria. Can we accept the recommendations? Everybody happy with that? Thank you. Right, now we appear to have come to the chair's update and close. Goodness me, I didn't manage that. Right, I have a few points here. The terms of reference have been updated and agreed by board members by emails and discussion at the SHIP and Health and Wellbeing Board workshop in September. Can I take a vote formally to adopt this, please? If you would, can I have a proposer? Thank you very much. And a seconder? Thank you, Rachel. All those in favour? Thank you. That's good. A response was provided on behalf of the board for the Telford and Wrekin Pharmacy Needs Assessment consultation. We've received 2 sets of correspondence from NHS England Primary Care Support. One, which I'm rather pleased about, is that Brown and Francis at 49 Bullring, Ludlow, will be increasing their opening hours by 10.3
Hours.
Which is helpful because actually the pharmaceutical situation in Ludlow is a little bit dodgy sometimes, and it's difficult for them all. And the pharmacy at 5 Cross Street, Ellesmere, will be operated by Day-Night Ellesmere Limited, and the pharmaceutical list for the area of Shropshire Health and Wellbeing Board will be amended with effect from that date. A summary of this correspondence will be attached to the minutes of the meeting. And on this occasion, I'd like to advise members that there will not be an after-board meeting. So may I close the meeting and thank you all very much for your contributions, your papers, your questions, and your engagement. Thank you so much. The meeting is closed.
Still live.
Yeah, we're live.